Hello everyone, welcome to this video from Human Body Institute. Today we are going to talk about the primary reasons that can lead to glaucoma. Glaucoma runs in my family and I would like to inform you about this eye condition. The silent thief of sight, glaucoma, is a progressive eye disease that can cause irreversible vision loss, if not handled correctly. Don't waste any more time if you haven't already enrolled. Click the bell icon to start receiving our wellness and health advice. If left untreated, glaucoma, a degenerative eye disease that damages the optic nerve, can result in irreversible vision loss. Because this condition is asymptomatic in its early stages, it is frequently referred to as the quiet thief of sight. Usually, glaucoma arises from a progressive increase in intraocular pressure that over time damages the visual nerve. The optic nerve is gradually damaged by initially elevated intraocular pressure without the patient experiencing any pain or discomfort. The patient may not notice the symptoms of glaucoma until the condition has progressed to more severe stages due to cumulative damage over time. Therefore, in order to detect glaucoma early and begin treatment before irreparable vision damage begins, it is imperative to have regular eye exams, especially for those with risk factors. Hazards associated with glaucoma. 1. Getting older. Our chance of getting glaucoma rises noticeably with age. One of the main risk factors for this eye ailment is advanced age. The risk of developing glaucoma is higher in older adults than in younger adults. This results from the body's and the ocular system's natural aging process. Intraocular pressure tends to rise with age, making a person more susceptible to the development of glaucoma. In addition to other elements like the aqueous humor's diminished ability to drain might be a factor in elevated ocular pressure. As a result, it's critical that elderly people understand this risk and have regular eye exams to catch any early warning signs of glaucoma. 2. Ancestry. One of the main risk factors for getting glaucoma is a family history of the ailment. Other family members are far more likely to get glaucoma if a family member, such as parents or siblings, has the condition. This implies a hereditary susceptibility to glaucoma. Individuals with a family history of glaucoma should be particularly vigilant about symptoms and get regular eye exams to monitor their ocular health, as studies have shown that the risk of developing glaucoma is up to 10 times higher in those with first-degree relatives affected by the condition. By identifying this risk factor, glaucoma can be detected early and treated effectively, reducing the chance of long-term problems. Unfortunately, my father has glaucoma and is already almost blind. I have myself checked annually and so does my sister. Unfortunately, my sister has been diagnosed with increased intraocular pressure. She has been referred to a specialized ophthalmologist, so it is really important to get tested if it occurs in the family. You must like the video if you've gotten this far, so hit the subscribe button and let's get to point 3. The third is increased intraocular pressure. Increased intraocular pressure poses a serious risk for the development of glaucoma. The equilibrium between the generation and drainage of aqueous humor, a clear fluid that fills the human eye, regulates the pressure of the fluid. A disturbance in this equilibrium can cause a rise in intraocular pressure, which can harm the optic nerve and result in glaucoma. Multiple elements. Some factors that may lead to elevated intraocular pressure include advanced age, a family history of the syndrome, certain medical diseases like diabetes and hypertension, and extended use of steroids. It is essential to continue routine intraocular pressure monitoring, particularly for those with risk factors, in order to detect glaucoma early and treat it well, therefore lowering the chance of irreversible vision loss. 4. Research on race indicates that race is a major factor in the development of glaucoma. Compared to those of other races, those of African or Afro-descendant descent have a noticeably increased chance of acquiring glaucoma. open-angle glaucoma is the most prevalent kind of glaucoma among African Americans, usually progressing more quickly and requiring more complex treatment. Even though the precise cause of this racial inequality is yet unknown, it is important to recognize that some groups are more vulnerable than others. In order to maintain ocular health, afflicted communities should exercise extra caution when it comes to getting regular eye exams and, if needed, seeking early treatment. 5. Hyperopia or myopia. The prevalent refractive disorders of myopia and hyperopia are also linked to the development of glaucoma. Because of their lengthened eyes, myopics are more susceptible to glaucoma due to increased pressure on the optic nerve. Conversely, those with hyperopia who have smaller eyeballs might have a narrower drainage angle, which would impede fluid flow and raise intraocular pressure. Even though corrective lenses for these vision issues can help with vision quality, regular monitoring of intraocular pressure and thorough eye exams are necessary to identify any early indicators of glaucoma. Those who have myopia or hyperopia should be aware of this increased risk and heed the advice of their ophthalmologist to protect their eyes and avoid glaucoma-related consequences. 6. Prior injury to the eyes. A history of ocular trauma can raise one's risk of glaucoma. Even relatively insignificant eye traumas have the potential to harm the optic nerve or obstruct the intraocular fluid drainage system, raising intraocular pressure. Bruising and other injuries essential eye structures for regular fluid flow might be harmed by cuts or perforations, which can raise intraocular pressure and accelerate the development of glaucoma. Furthermore, a history of eye surgeries, such as cataract or glaucoma surgery, may raise the chance of developing glaucoma-related issues down the road. People who have previously suffered eye injuries should see an ophthalmologist on a regular basis and report any unusual symptoms, such as pain or changes in vision, to them. Prompt diagnosis and suitable management can avert severe consequences associated with glaucoma. Systemic disorders rank 7. Systemic conditions including diabetes and hypertension are linked to an increased risk of glaucoma development. These disorders have an impact on vascular health, which may reduce blood flow to the eyes, raise intraocular pressure, and harm the optic nerve. While hypertension may be a contributing factor in normal pressure glaucoma, those with diabetes are more prone to develop open-angle glaucoma. Moreover, inflammatory diseases and arteriosclerosis can have an impact on the development of glaucoma. Patients suffering from systemic disorders must constantly check on the condition of their eyes and get periodic eye exams. Proper management of the underlying ailment, in conjunction with ophthalmic follow-up, can help lower the long-term risk of problems connected to glaucoma and maintain visual health. 8. Long-term corticosteroid usage. These drugs, which are frequently administered to treat inflammatory autoimmune diseases, have the potential to raise intraocular pressure through enhancing ocular fluid production or decreasing the ability of the eye to drain fluid. Corticosteroids can be given as injections, tablets, topical creams, and eye drops, among other forms. The longer and higher the dosage of corticosteroid medication, the higher the risk of glaucoma. Patients who take these drugs for a long time should have their eyes checked frequently by an ophthalmologist to ensure that their eyes are healthy and to look for any early indicators of increased intraocular pressure or damage to the optic nerve. In certain instances, ocular problems may require medication adjustments or alternatives to be considered. Ocular anatomy is covered in Chapter 9, can potentially affect the likelihood of getting glaucoma. Certain structural features of the eye may make people more vulnerable to this illness. For instance, a narrow angle separating the iris and cornea may obstruct the normal flow of aqueous fluid within the eye, raising intraocular pressure. Additionally, certain variations in optic nerve anatomy, such as the presence of an abnormally shaped optic disc, may increase Although these anatomical factors cannot be modified, they underscore the importance of regular evaluation of ocular health, especially for individuals with anatomical characteristics that may increase the risk of. Enough ophthalmic monitoring can aid in the early diagnosis of the illness and the application of preventative treatments to maintain vision. 10. The existence of heart-related conditions. An elevated risk of developing glaucoma is also linked to the presence of cardiovascular illnesses. Ocular health can be impacted by diseases including stroke, coronary artery disease, and hypertension in a number of ways. For instance, high blood pressure can directly impact intraocular pressure, which can lead to the development of glaucoma. Moreover, cardiovascular conditions may impair blood flow to the optic nerve and other ocular tissues, making the latter more susceptible to harm from high intraocular pressure. Patients with cardiovascular illnesses should be aware of this elevated risk and have frequent eye exams to keep an eye on their ocular health. An integrated strategy that addresses ocular health as well as the appropriate management of cardiovascular conditions can help lower the long-term risk of glaucoma-related problems and maintain vision. Potential glaucoma treatments. Depending on the disease's stage and the intensity of symptoms, glaucoma can be treated using a range of approaches. One is the use of eye drops and oral drugs to lower intraocular pressure through either reducing or facilitating the generation of fluid or its drainage. 2. Intraocular pressure is decreased using laser surgery techniques such trabeculoplastin laser iridotomy, which enhance fluid flow within the eye. 3. Advanced stages of standard surgical procedures. In order to release pressure, trabeculectomy or drainage implantation develop new drainage pathways. Treatment is tailored according to the disease's course, how well it responds to it, and the patient's general health. The optimal course of treatment is decided for each patient by a glaucoma expert. In conclusion, glaucoma is a dangerous eye ailment that needs to be treated. You may contribute to the awareness-building process on glaucoma prevention by subscribing to and sharing this video. Together, we can protect our vision and promote ocular health. We can warn our family and ensure that investigations are done in time. Thank you for joining us on this important mission. Don't forget to subscribe and share the video.